Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone. My name is Ais Ulfi. I'm student nutrition department Polytechnic Hot Kemenkes Semarang. Thank you for giving me the opportunities to talk. And for the next 10 minutes, I will be talking to you about the effectiveness of the Nutri Diabetic application on diabetes mellitus diet compliance. The epidemiological transition is characterized by increased mortality and morbidity due to non-communicable disease, one of which is diabetes mellitus. There needs to be a controlled effort to prevent an increase in the incidence by provide education in the form of nutritional counseling to patients by utilizing media. According to Kemenkes, diabetes mellitus is a chronic metabolic disorder caused by the pancreas not being able to produce enough insulin or the body cannot use the insulin product effectively, resulting in an increase in the concentration of glucose in the blood. The presentation will be in 4 parts. First, I'm going to talk about the definition Nutri Diabetic application. Part 2, argument about the effectiveness of education in the application. Part 3, the effectiveness of the application in provide counseling regarding the amount of food consumed. And part 4, argument about the effectiveness of the application regarding counseling the type of food consumed. If you have any question while I'm speaking, please save them for the end of the presentation. I give you an email address. First, I like to talk about definition Nutri Diabetic application. Ulfi states that the Nutri Diabetic application is an Android-based application specifically designed to help people with diabetes mellitus in implementing the diabetes mellitus diet at home and increase the understanding of people with diabetes mellitus about the diabetes mellitus diet. This application contains material about the diabetes mellitus diet, procedure for calculating daily needs, recall of eating a day to control the intake of people with diabetes mellitus according to their respective needs. This application provides several features such as meal schedule alarm, calculating daily intakes, material about the diabetes mellitus diet. In the first topic has been explained the definition of Nutri Diabetic application. I would like move on to effectiveness of education in the application. Increased knowledge occurs because the Nutri Diabetic application is equipped with features that support of to improve diabetes mellitus diet compliance. Laila states that the use of diabetic nutrition application on Android, there is a significant change in knowledge related to diabetes. Medical nutrition therapy and physical exercise between the intervention and control group. And there is an increase in knowledge of pharmacological therapy. According to us, the use of telecommunication media, especially in the use of smartphone application, is very effective in influence adherence to therapy program, both diet and physical activity in type 2 diabetes mellitus patient. Can be concluded that there was an increase in knowledge after counseling using the diabetic application. 3. Nutri Diabetic application has a feature to monitor the amount of food consumed by respondent. Respondent can evaluate their intake by using the My Food Data feature on the Nutri Diabetic application. Based on table, according to Winaningsih, it can be seen that there is a significant difference in compliance respondent to the amount of food consumed before and after treatment. As stated by the study, so that there is a tendency for higher dietary adherence is respondent who receive education, then those who did not receive education. From the study statement, it can be concluded that respondents can evaluate the amount of intake using the figure on the nutritional diabetic care application. According to Roiko, there is a significant difference in the type of food complaints after being given nutrition counseling treatment using the Nutri Diabetic Care application. There was an increase in adherence to the type of food between before and after counseling. After counseling, respondents can reduce the frequency of consumption of food containing saturated fat such as fried food and drink containing sugar such as sweet tea and sweetened condensed milk. Before finish, let me just summarize the main point. Evidence that presented has shown that the effectiveness of application-based diabetes mellitus education has an effect on knowledge and counseling help improve the compliance. I hope to have been able to show that the Nutri Diabetic application media can be used as a guideline in carrying out the diabetes mellitus diet. Thank you for your attention. If you have any question, can be sent via email aisulfi9@gmail.com. Wassalamualaikum warahmatullahi wabarakatuh.